Hey everybody, my name is Jake and we're going to talk about concussions today. So we're going to get into what a concussion actually is. There's a traumatic brain injury that it's going to affect brain function. It can be caused by a lot of different things, most commonly just a blow to the head, but it can also happen due to the whiplash effect, like in a car accident. Basically anything that can cause a contusion to the head and the brain. The main symptoms are headaches, problems with concentration, memory, balance, and coordination. And depending on the severity of these symptoms, it's going to be dependent on the severity of the concussion. So the worse the symptoms, the worse the concussion. These signs and symptoms may not happen immediately. They can happen a few minutes to hours after the concussion, and they can also persist up to months in some cases. Lots of people think that you have to lose consciousness to get a concussion, but that's not true actually. Depending on if they do lose consciousness or not, depends on the severity of the concussion. So if you're out for a long time, it's going to be a much worse concussion than if you were not knocked out. A few more of the signs and symptoms will be how the patient feels and what they look like. So if the patient feels nauseous, is sluggish, or is bothered by light or sound, those are some pretty telltale symptoms. But that you can also notice how they're acting. So if they're slurring their speech, showing mood or behavior changes, and if they move clumsily or talk slower than usual, those are also some other signs. So you kind of have to look at not just what they say they're feeling, but how they look. And also, you want to ask them about what happened before or after the incident, because if they have amnesia and forgot a lot pertaining to the incident, that's going to be another sign that's a severe concussion. Getting into the epidemiology of it is that concussions can happen to lots of different type of people. They did a study with NPR that said that about 23% of people in the US have had a concussion, so almost 1 in 4. Risk factors are usually lifestyle and activity related, but there is some new science saying that different genes may cause you to be more likely to have a concussion. 2 of these genes are specifically listed here, and if you have a variant of these genes, then you may be at a greater risk. So here are some of the stats. You kind of see it's a pretty varied breakdown of who gets concussions. It's a little less for older people, which makes sense because the younger you are, the more likely you are to be in an active contact sport. So that's where a lot of those concussions come from. But the older you get, these concussions usually come from a motor vehicle accident or a fall or something like that. Getting into the pathophysiology of it. So when the concussion happens, there's a sudden release of excitatory neurotransmitters. And this causes potassium to leave the neuron and go into that extracellular space. And then calcium rushes in. So this causes the neuron to enter a glycolytic state, and the membrane pumps have to be activated to get to switch that potassium calcium ion. This also causes lactate to build up because it can't use glucose the way it usually does to be metabolic. So this impairs the neuron function and then also reduces blood flow. So none of these things are good, obviously. So, but if calcium remains in the mitochondria, this can cause a lot more lasting damage, and that's why you really want to take your time with concussions and let the rest happen and sort itself out. So we'll look at this chart for kind of show you the different ways that the actual physiology of it leads to the symptoms. So you get the traumatic brain injury and the mechanical perturbation, and then this leads to the different ions, which is the calcium and potassium, which leads to the metabolic crisis. And then this depolarization means the cell can't act the way it used to. It can't send those waves of depolarization down from the neuron to the synapse, and it can't act the way it wants to, and so that's how you get those headaches. And then if the axon is like actually injured, which can totally happen, that's another reason for impaired cellular function, and that will slow your reaction time because the neuron can't move the same way it's supposed to, and it's just slower. And then obviously when you hit something, you get inflammation, and if it's really bad, you get the cell loss, and that leads to the long-term neurodegeneration, which is just not good and can mess up your cognitive functions for life. So then here's some more pathophysiology of it, kind of showing at the neuron level. So if you look at the far left, the potassium ions are going to rush out after getting hit, and then the calcium is going to rush in. And that is what causes the energy crisis state, the glycolytic state. So we know that it's going to be vulnerable, and that can lead to the cell death if it gets any worse. And then if you look at the synapse there, the neurotransmitters are the huge release of them going to the next neuron. That's where that confusion and memory loss issues come from. So then we can get into the medication diagnosis and recovery. So if you look here, this is a pretty common symptom. You can see one pupil bigger than the other, and this is a telltale sign of a fairly serious concussion. So you're pretty much always going to want to see a medical professional unless it's just a bump to your head, like if it's a kid just playing and bumps their head. But if they really show any signs, you really want to go see a medical professional. It's really not something to joke around with. So some of the more severe symptoms that you can look out for is vomiting, a headache that gets worse, the unequal pupil sizes that we saw, and weakness in the arm or legs. So when you go to the doctors, they're going to do a neurological examination, which is going to do vision, balance, reflexes, and strength and sensation, see kind of what part of your head was affected. And then they can also test your memory and concentration. A lot of sports teams have pre-tests for this, so that when they get a concussion, they have baseline scores that they can go back to and make sure that everything is okay and as it should be. So finally, they can use tests like MRI or CT to find the full extent of the issue. Right after the concussion, you can take things like aspirin, ibuprofen, and naproxen sodium to alleviate the pain and some inflammation, but there are no real medications you can take for the concussion, mostly just time. So how concussions affect exercise? So the first couple days after, you're pretty much not going to want to do that much. You're going to want to limit your screen time, limit your physical activity, especially really intense stuff, and you're just not going to want to do anything that provokes the symptoms or makes the person feel worse. So that's for the first few couple days. After that, you can start to add in some things, and you may want to look into using low intensity exercise to improve blood flow. So something really low intensity. The most important thing is to block stuff and not have the patient do anything that causes further injury. So you're not going to want to have people lifting heavy weights over their head or doing handstands or anything really like that, or playing their sport, if they can get hurt again. That's going to be the biggest issue. And then, so it's interesting because exercise is medicine. So exercise can actually help before you get a concussion, and it can help lead in that recovery. So people used to think that just resting for like 5 days after was the way to go, but it doesn't really seem like that's true anymore. And it seems to really only rest for a couple days until the symptoms kind of abide, and you just, from there, you can start to add in slow things like the low intensity aerobic exercise that we talked about, like a stationary bike or a very light jog. And that's really, if they're an athlete. Like if there's someone that is much older and doesn't normally jog, you're just going to want to have them do something very light, and just to get a little bit of recovery, like maybe a little walk. But the other interesting part is that you can actually use exercise to prevent concussion. So most studies have been done with sports, but they have found that quicker reaction times have been shown to reduce concussion risk and severity. So if you can react right before you're about to get hit and kind of cushion that blow, it's going to be much better than just completely getting blindsided. And then that also goes in with the visual training in specific sports like college football, to where if your eyes can keep up with the movement and the task that you have at hand, then you'll be able to block that hit or just be ready when that hit comes to not completely get blindsided and knocked out. And then there's also a few new studies that show how neck musculature strength can reduce concussion risk, kind of stopping your head from flying all around if you get hit. So they did a study with high school athletes, and they found that the odds of concussion risk decreased by 5% for every 1 pound of neck musculature strength. So for my case study, I found an extremely motivated 21-year-old college football player recently had a mild concussion last week during practice. He comes to you on a Monday expecting to get a lift in with you, who is the strength and conditioning coach, and the team. He's otherwise healthy and has no underlying conditions. He wants to get back to lifting as soon as possible. So for him, if I already know who he was, I may already kind of know his baseline values and not have to do an exercise test. But for someone with a concussion, you really want to do something that isn't going to have them get hurt again and is going to keep them safe for the short term. So something like a 6-minute walk test or handheld dynamometer just to get some values and be able to plan accordingly would be good tests. For him, I would just conduct a balance test to make sure that he's like okay and can actually perform some exercises, and then I would start having him with the very low intensity exercises. After a little bit, I would use our assessments that we normally use, like a 1 rep max trap bar deadlift, a vertical jump, and a 40-yard dash, so we know he's still covering well. I would also make sure that, obviously, that the concussion was mild and the team doctor cleared him and he was able to exercise in every other way and was otherwise generally healthy. So for the prescription, for week 1, we're just going to do those aerobic sessions 3 times a week just to get recovery in and make sure that his symptoms aren't getting worse. I would also throw in a little bit of balance, maybe like some storacles or some tandem stance balances, just to give him something else to do so they can feel like he's still working hard. Because in most sports, and especially in a college athlete's space, they want to get back to working out as soon as they can, but I just want to be able to give him something that he can use to show that he's getting work done and getting better. And then so week 1 through 4, we're going to slowly add in that exercise, and that's going to be resistance training, aerobic training, and balance training. So we're going to start kind of low with the intensity of 40% to go to 60 to 80%, and then the duration and volume of these workouts also going to increase with the aerobic training. And then the balance training will also continue to make sure there's no lasting effects and everything's okay. And then week 4 after that, depending on that, he might be back to where he is. He may have to do some more testing with his pre-test concussion too. So once he's back, they'll continue to train for that sport and resist by continuing to do the resistance training and doing all the things that they normally do. And then in the future, we're going to keep that neck training, rack training, visual training to hopefully reduce the risk of any more concussions. Finally, really the most important thing when training someone with a concussion that you need to take into account is allow the healing to take place. So it's going to be different for everybody, especially if you have an athlete and if you have an older person. It may take a little longer for the older person. And you just want to make sure that you don't rush the healing process and you don't put them in a space where they can hurt themselves again. But on the same side, you want to have enough nuance and know enough to get them back to doing something, and then meet them where they are and formulate a plan to use the things that they've been doing, slowly add that in, a little bit of aerobic training in the beginning, and then keep an eye out on the new sciences that come out all the time, like the neck training and the reaction time training, because these things seem to be very promising. There are some sources. Thank you.